Welcome back to Upfront. Governor Evers' mask mandate was originally set to expire tomorrow, but the governor declared a new public health emergency, extending the mask mandate to November 21st. He cited rising cases specifically on college campuses. Republicans responded right away. Senate Majority Leader Scott Fitzgerald saying the new mask mandate is not worth the paper it's printed on and almost assuredly headed for litigation. Assembly Speaker Robin Vos called it obviously illegal. So to talk about Wisconsin's coronavirus cases, we now have Dr. John Raymond. He is the president and CEO of the Medical College of Wisconsin. We always really appreciate it when you can come on the show, doctor. And I think the thing we should start with is what we've been talking about is that mask mandate. And you know, we have a lot of politicians on this Upfront program, so we hear the political side of masks. And I want to hear from you, the medical side. In Wisconsin, are we seeing any kind of proof that masks are working?
Yeah, thanks so much, Adrienne. This is a very important question. I'll try to answer it from a public health perspective and not from a legal or constitutional perspective. You know, there are three relevant factors that we need to consider. First of all, COVID-19 cases are surging throughout the entire state, and that's very important to note. There's also overwhelming evidence now that masks do mitigate the risk of transmission of COVID-19 and that they protect both the wearer and those around them. And finally, we know from other states and other countries that mask mandates do increase the percentage of people who actually wear masks. So from a public health perspective, anything that we can do to increase mask usage should help us to slow the spread of COVID-19 and protect our people, our communities, and the economy.
And I think a follow-up could be, well, we're wearing masks now under this mask mandate, but we still have our cases going up. Yeah. Why do you think that is?
Well, that's really a good question, and we are surging. We're one of the states that have been identified as a state that's having problems with COVID-19. And what I'd say is we are surging in terms of new cases and hospitalizations. This has been a trend that's really just occurred over the last 2 to 3 weeks, and both of those have reached all-time highs. And we also know that most of the new cases are in young adults between the ages of 18 and 24. And the surge became very apparent to us right around Labor Day, maybe a little after that. So there also is perhaps an element of relaxed social distancing that always happens around a holiday. But clearly, students returning to college are driving much of the surge. But it's important to note that the surge isn't happening just in counties with a college or university. 70 of Wisconsin's 72 counties had high activity as of yesterday's Wisconsin Department of Health Services report, and 42 of those counties showed an acceleration of the pandemic. So in addition to the return of students, I also believe that mask and lockdown fatigue are contributing to the problem, as well as persistent skepticism about the effectiveness of masks to mitigate the spread of COVID-19.
And Wisconsin is ranked 4th in the nation by the Centers for Disease Control for overall case numbers in the past 7 days. That's definitely not a good list to be on. And I know we keep going back to this campus question of colleges and universities, but other states have colleges and universities too. So why are we doing so poorly right now?
Yeah, I really don't think there's a good answer to that. What I would say is we know from a recent pre-publication study from University of Wisconsin-Madison that voluntary mask wearing and social distancing in Wisconsin, we haven't been particularly good at that compared to other states. So what they did was they examined people in May and June that were leaving grocery stores, and only 41% of the people leaving had masks on. And so there may be, again, just a high level of skepticism here about the utility of wearing masks.
And Dr. Raymond, there are so many numbers when we look at the data here. I mean, you have positive tests, negative tests, percentages, hospitalizations. Which number specifically do you feel like we should be looking at to see if we're doing better?
That's such an important question. And the problem is there's no single indicator that tells us how we're doing with the pandemic. We need a number of different metrics to assess the overall picture so that we really can understand where we stand with the pandemic at any point in time and then predict where we might be a few weeks down the road. So the most important early indicators, and you've already mentioned some of these, are the numbers of new cases, the positivity rate, which is the percent of tests administered that come back positive, and the reproductive number, which is a measure of contagiousness at a given point in time. Then a few weeks down the road, you have hospitalizations, intensive care unit use, and overall bed capacity in the health systems. And so those are intermediate lagging indicators. And then the one I think that we focus on the most is the most lagging indicator, and that would be deaths. And those lag 4 to 6 weeks after the increase of new cases. Now, those have been relatively stable for the last few months in Wisconsin, but we do note now for the first time in a few months that our hospitalizations and intensive care unit use have gone up. So it'll be important for us to monitor those deaths over the next few weeks to come.
Dr. Raymond, thank you.
Thanks, Adrienne.
So how important do people think a Supreme Court justice really is? Marquette Law School has a new national poll.